Hello everyone, welcome to Mediverse Atlas. In today's video, we are going to talk about the anatomy of mammary gland or the anatomy of breast. It is an LAQ, an important LAQ in the upper limb. Okay, before entering deep into the concept, we'll be just going through the basic points of mammary gland. Okay, so mammary gland is a modified sweat gland found in both males and females, but it is rudimentary in males. And what is its function? It provides nourishment to newborn in the form of milk. And what is the location of mammary gland? Mammary gland is located in the superficial fascia of the pectoral region, the region of chest. Okay, superficial fascia of the pectoral region. And here we need to talk something about axillary tail of spines. Before going into the concept of axillary tail of spines, we need to know another thing, that the mammary gland is divided into four quadrants. Okay, think this as the lateral side and this as the medial side. So it is divided into four quadrants as upper medial quadrant, lower medial quadrant, upper lateral quadrant, and the lower lateral quadrant. Okay, these are the four quadrants of the mammary gland. Okay, so now what is this axillary tail of spines exactly? So this axillary tail of spines is a small extension from the upper lateral quadrant, like this. So this axillary tail of spines is the extension from the upper lateral quadrant of the mammary gland. Okay, and this axillary trail of spines, it pierces deep fascia and extends till axilla through an opening called foramen of Lange. Okay, I'll just show you this in diagram. You can appreciate that the axillary tail of spines is from the upper lateral quadrant. Okay, and this axillary tail of spines, it pierces the deep fascia and enters the axillary region through foramen of Lange. Okay, there is a foramen of Lange. From this foramen of Lange, this axillary tail of spines, it pierces the deep fascia and enters into axilla. Okay, this is about the axillary tail of spines. And what about the shape and extension, or shape and the extent? Okay, shape is variable, conical it is variable, shape is variable. Okay, this might be conical or hemispherical. And extent, there is vertical extension and horizontal extension. Okay, vertical extension, it is from the second rib. Okay, at this sternal angle, it is from the second rib to the sixth rib. This is the vertical extension. Whereas what is the horizontal extension? This is from the lateral border of sternum to the mid axillary line. This is the horizontal extension. Vertical extension is from the second rib to sixth rib, whereas horizontal extension is from the lateral border of sternum to the mid axillary line. And one more important point to note here is, at the level of fourth intercostal space, nipple is present. This nipple is present at the fourth intercostal space. Okay, this is about the shape and extent. Now let us talk about the relations of mammary gland. So relations of mammary gland from the superficial to deep are, first there will be skin, there will be superficial fascia, then there is deep fascia, and there are some muscles. What are these muscles? You can remember this muscle as PES, PES, pectoralis major, external oblique, and serratus anterior. Okay, and we have retromammary space which is filled with fat. You can appreciate here, this is the pectoralis major muscle, and this is the clavipectoral fascia, and this the yellow thing is the retromammary space. So from the superficial to deep, the relations are deep fascia, muscles. What are these muscles? Pectoralis major, external oblique, and serratus anterior, and retromammary space which is filled with fat. Okay, so you can represent this diagram in the exam. Now we'll be studying about the structure of breast. Structure of breast can be studied under three headings as skin, stoma, and parenchyma. So first we'll be talking about skin. Skin is further studied into two subheadings as nipple and areola. Now what is this nipple? This nipple is a conical projection, and this nipple, it is pierced by 15 to 20 lactiferous ducts. Okay, these lactiferous ducts, they deliver milk. Okay, so these lactiferous ducts, they pierce the nipple. Okay, there are almost 15 to 20 lactiferous ducts which pierce the nipple, and this nipple, it contains smooth muscles. Okay, these smooth muscles are both longitudinal and circular. So both longitudinal smooth muscle and circular smooth muscles are present at the area of nipple, and this nipple, it is rich in nerve supply. Okay, And now areola. Now the skin surrounding the nipple is called the areola. See, this is the nipple. The skin surrounding this nipple, this is the areola. Okay, and this areola is rich in modified sebaceous glands. Okay, at the outer margin, mainly, mostly, this is the areola, and this is the outer margin of areola. Mostly at the outer margin of areola, it is rich in sebaceous glands. Okay, now what is the significance of this? These sebaceous glands, they are enlarged during pregnancy and lactation to form tubercles of Montgomery. Okay, so what is the meaning of this? These sebaceous glands, they get enlarged during pregnancy and lactation to form the tubercles of Montgomery. So these tubercles of Montgomery are nothing but the sebaceous glands only. They are enlarged sebaceous glands. Okay, in simple words, these tubercles of Montgomery are nothing but these are enlarged sebaceous glands which during the pregnancy and lactation. Okay, again, the skin of areola and nipple are devoid of hair and no fat under it. Okay, there is no presence of hair and fat under the areola. Okay, so this is about the skin. Next we'll talk about the stoma. Now stoma is again studied under two headings as fibrous stoma and fatty stoma. Now what is this fibrous stoma? Fibrous stoma is the fibrous stoma, it forms septums inside. Suppose think this as mammary gland, it forms septums like this. Okay, these septa are known as suspensory ligaments of Cooper. These suspensory ligaments of Cooper, they anchor the gland and to the pectoral fascia. Okay, suppose think this as pectoral fascia, this as gland, this suspensory ligament of Cooper, they anchor like this. Okay, I will show you in the diagram. See, these are the suspensory ligaments of Cooper. They are anchoring the gland to the pectoral fascia. You can see there are extensions like this. No, these are known as the suspensory ligament of Cooper, and they are forming septums. See, they are forming septums. So this stoma, it is known as fibrous stoma. Okay, and it maintains the normal shape and extent of the breast. Which one? Fibrous stoma. Now what is this fatty stoma? It forms the major bulk of gland. Okay, in fibrous stoma, the most important point is the suspensory ligaments of Cooper. They anchor the skin and the pectoral fascia, and they maintain normal shape of breast. Now we'll talk about parenchyma. Parenchyma, what is exactly parenchyma? Parenchyma, we can study parenchyma as in the form of lobes. Okay, mammary gland consists of 15 to 20 lobes inside them, and each lobe, parenchyma is basically the main gland. It is the main gland, the main functional gland. Okay, parenchyma is the main functional gland, and it contains 15 to 20 lobes. Okay, and each lobe drains into lactiferous duct, and each lobe contains lobules. I'll be showing it to you in the diagram. See, this is one lobe, and each lobe contains lobules. This one. Okay, and these drain into first into lactiferous sinus and into lactiferous duct. Okay, this one, each lobe contains many lobules. These are also known as alveoli or acini, in which milk is secreted. Milk is drained into the ducts, passing through the lactiferous sinus, finally into the lactiferous duct through nipple. Okay, I hope you understood this point. See, it contains many lobules. Lobules have clusters of alveoli or acini. See, this is a lobe, this is a lobule which contains acini or the alveoli. Okay, I hope you are clear. Lobe, lobule, acini. Okay, clear, I think. Now let us talk about the arterial supply, the main point, the arterial supply of mammary gland. The mammary gland is mainly supplied by three arteries. Okay, these are internal thoracic artery, lateral thoracic artery, thoracoacromial artery, and intercostal artery. The three main branches. Okay, there are branches from the three main arteries. Okay, the first artery is the internal thoracic artery. This internal thoracic artery, it is a branch of subclavian artery. The subclavian artery is present beneath the clavicle. Okay, so internal thoracic artery. See, this is the internal thoracic artery. It is a branch of subclavian artery. Okay, next the two arteries, the lateral thoracic artery and the thoracoacromial artery. So this is the lateral thoracic artery and the thoracoacromial artery. These two are the branches of axillary artery, and the last one is the intercostal arteries. Okay, fine. See, internal thoracic artery. This is the internal thoracic artery, which is a branch of subclavian artery, and the lateral thoracic artery as well as thoracoacromial artery. It is a branch of axillary artery and intercostal artery. Finally, these are the four main arteries supplied from three main branches. Okay, draw this diagram in the exam like this only. Okay, now veins follow the arteries. Superficial veins drain into internal thoracic vein, whereas deep veins drain into the axillary vein. Okay, now the lymphatic drainage, the most important thing of mammary gland is the lymphatic drainage. This lymphatic drainage can be asked as an SAQ also, separate SAQ. Okay, please do focus on the lymphatic drainage. So in this lymphatic drainage, lymphatics can be divided into lymph nodes and lymphatic vessels, and lymph nodes again are divided into axillary lymph nodes, parasternal lymph nodes, intercostal lymph nodes, and the subdiaphragmatic or the subperitoneal lymph nodes and lymphatic vessels. Finally, now see, these axillary lymph nodes are a group of lymph nodes. In this group of lymph nodes, there are multiple lymph nodes are present. So what are these lymph nodes? Anterior, posterior, lateral, central, and apical. So these are the axillary lymph nodes. And parasternal lymph nodes. What do you mean by this parasternal lymph nodes? Think this as sternum. The lymph nodes present on the either side of sternum are known as the parasternal lymph nodes. Okay, these are the parasternal lymph nodes, and they drain most medial side of the breast. Okay, so breast is present like this, no? So this is the medial side of the breast, no? So this is the medial side, right? This medial side is mostly drained by these parasternal lymph nodes. Okay, next, posterior intercostal nodes, they drain the deeper parts of breast. And the next, the subdiaphragmatic and the subperitoneal nodes. The subdiaphragmatic, that is the lymph node present beneath the diaphragm. Okay, so these lymph nodes which are present beneath the diaphragm drain the most inferior parts of the breast. You can appreciate these things in the diagram. See, this is a very schematic diagram. You can represent like this in the exam. Okay, see, next, first, axillary lymph nodes. These axillary lymph nodes are categorized, no? So this one, apical, this is the apical lymph node which is present beneath the clavicle. Okay, next, the central, the anterior, the posterior, the lateral. Okay, so these are the axillary lymph nodes. And we have parasternal, which are present on either side of the sternum, and we have posterior intercostal, and we have subperitoneal. Okay, I hope you are clear with the lymphatics. Remember these names of the lymph nodes and this diagram, and write this flowchart and come. You will be scoring good marks in exam. And one more important point to note in the lymphatics of the mammary gland is about the subareolar plexus of Sape. Subareolar plexus, that is, there is a plexus of lymphatics present beneath the areola. Okay, this subareolar plexus of Sape is present beneath the areola, and it drains into the anterior group of lymph nodes, that is the anterior axillary nodes. They drain into these things from the beneath the areola to anterior axillary lymph nodes. Which one? Subareolar plexus of Sape. Okay, and we have lymphatic vessels. We have superficial vessels as well as deep vessels. Okay, I hope you are clear with the lymphatics. If you have any doubt, please do comment in the comment section. And the last and but not the least, this is a very important part of every concept in the anatomy, the clinical anatomy. Okay, if you write clinical anatomy after every question in anatomy, if you at least write 2 to 3 points of clinical anatomy in anatomy, you will be scoring a very good marks. Okay, so next, in clinical anatomy we are going to discuss about the carcinoma of breast, that is breast cancer. Okay, so these are just facts. So these are some points which you need to remember, that's it. Okay, so first lymph node draining the tumor bearing area is called sentinel node. Of course, carcinoma of breast means cancer cells, they accumulate, they form tumor, right? So this tumor bearing area, there will be some lymphatic drainage. So the draining area of the lymph node, it is called the sentinel node. Okay, suppose here is the tumor, Here is one lymph node. Lymph is drained like this from this tumor bearing area. So this lymph node, it is called as the sentinel node. And one more important point, the radial incisions are made for surgical correction of breast cancer. What is the reason for the radial incision? To avoid the damage of lactiferous duct. And we need to talk something about here as a powdery orange appearance. It is important for MCQ point of view. Okay, powdery orange appearance or the orange peel like appearance. Why it is caused in breast cancer? So what happens is these cancer cells cause the obstruction of superficial lymph vessels, produces edema and gives rise to appearance like that of skin of orange. Okay, due to obstruction of superficial lymph vessels there is edema and there is appearance of orange like thing, orange like skin. So this is about the powdery orange appearance. Next we need to talk about Kurkenbach's tumor. This Kurkenbach's tumor is nothing but is a secondary tumor. Okay, in the breast cancer there is a high risk of Kurkenbach's tumor. Why there is high risk of Kurkenbach's tumor? Due to deposition of cancer cells in ovary. How it is linked? See, the cancer is in the breast, then what is related to ovary? Because there is spread of lymphatics. Through lymphatics the cancer might spread from the breast to ovary, which causes deposition of cancer cell in the ovary, leading to Kurkenbach's tumor. I hope you got my point. And one more thing as mammogram, they reveal the cancerous mass. Mammogram looks like this. You can see the cancerous mass here. And this is about the anatomy of mammary gland. If you have any doubts, please do comment in the comment section, and don't forget to follow on Instagram. Thank you. See you. Bye.